we go. Good evening, everyone. It is Fertility Talk Live. Good evening, everyone. Fertility Talk Live. It's Wednesday evening, and we're just going to give everyone a couple of minutes. There we go. Okay. Good evening, everyone. It's Fertility Talk Live, Wednesday evening, and tonight we are talking to Elsa van Blerk. She is an embryologist. I think she's head of the andrology department at Wijnland Fertility Clinic, and that is out in Cape Town. It's in Cape Town. It's in the Wijnland area. I think Somerset. And yeah, so tonight's topic is what can I expect on Embryo Transfer Day. So we're just going to give you guys a couple of minutes and everyone to join us. And then we've got quite a few good questions. Remember, at the end of the talk, if you guys have any questions regarding fertility and, if you are going through IVF or you're going to be doing IVF soon and you have any questions, please put it in the comment section. If at the end of the talk we've got enough time, we will obviously answer those questions. We'll ask Elsa. And if not, we can just always pop them an email and someone there would be able to assist us. So I'm going to send Elsa an invitation now. There we go. She can accept. I've just sent it. I'll just wait for her to join us. Okay, there we go. Hi, Elsa.
Hi, how are you?
Fine, and yourself?
Good, thank you. Can't complain.
Jay, thank you very much for joining us this evening on another fertility talk.
Thank you very much for having me.
Pleasure. I think that there probably is a bit of a delay, which always happens. So tonight's topic is what can I expect on Embryo Transfer Day. But before we get into that, if you don't mind, please introducing yourself. Tell the audience who you are, where you're from, what it is that you do every day.
Thank you very much for the introduction. And again, thank you very much for the opportunity. We always like it to be on your page and to share the information with the listeners. So I'm Elsa van Blerk, and I am an embryologist at Wijnland Fertility Clinic, and we are located in Stellenbosch in Cape Town area. I am the head of the andrology department. I love embryology and andrology, but I must say working with the men is the favorite part for me. It's quite near and dear to my heart, and I love to create that space for the men in the infertility industry as well. So yeah, that's basically me in a nutshell.
Awesome. So we've got a few questions, and like I've mentioned earlier, if you guys have any questions for those of you who are going to be doing IVF soon or thinking of IVF, and you have any questions, please put it in the comment section. If we don't get to it at the end of the talk, what we always do is we will send it to Elsa, and she'll be able to respond or get one of the doctors to even respond to some of the questions. So that's great. Our first question is, what is an embryo transfer and when does an embryo transfer take place?
Okay, so an embryo transfer simply means it's the day where we finally get to give the embryo its home. And that's what I like to tell patients. So it's usually an embryo that has been culturing in the lab for 5 days approximately. And it's the day that we put the embryo back into the recipient's uterus. So there's a slight difference between when we do a fresh embryo transfer cycle or when we do a frozen embryo transfer cycle. So if we speak about a fresh transfer cycle, we refer to a patient that had the eggs taken out and an embryo put back in the uterus in the same cycle. So for those patients, it would be 5 days after your oocyte retrieval. Then if you talk about the frozen embryo transfer cycle, so those are those patients that either has natural frozen cycles or that has a down-regulated frozen cycle. So for those patients, we froze embryos in a previous cycle. So we did not transfer an embryo. We froze all the good quality embryos, and they came back a month or two later to now receive the embryo that we are going to thaw for them. So that's a frozen embryo transfer cycle. So for those patients, the embryo transfer would possibly be between day 17 and 19 of their cycle.
Okay. What medication do I have to take to prepare for an embryo transfer?
So I know when patients hear medication and it's IVF, they always get these big eyes, but I don't think the type of medication that they get when we prepare them for an embryo transfer is that hectic compared to when we stimulate them. So the goal of the medication that they receive to prep them for an embryo transfer is more to prepare their uterine lining to accept the embryo and to help the embryo implant and develop further. So again, there's a slight difference between the two transfer cycle types. So when it's a fresh embryo transfer cycle, the patient will start taking vaginal progesterone on the evening after the oocyte pickup. So this vaginal progesterone would either be a gel, a cream, or a PCRE. Okay. And they will continue to use the progesterone until the day of the embryo transfer. After your embryo transfer, you would get, again, at Wijnland Fertility, that is how our protocol works. So the patients would then get an intramuscular or a subcutaneous progesterone administration right after the embryo transfer. And then after that, they would continue with their vaginal progesterone until 8 weeks of pregnancy or until we advise them to discontinue the administration. Okay. So the reason why we give them that intramuscular or the subcutaneous progesterone is just to help block any possible uterine contractions that can occur after the embryo transfer. Okay. And then when we look at frozen cycles, the patient will receive vaginal progesterone as well as the subcutaneous and intramuscular progesterone and estrogen. So they would get those 3 medications for the preparation. Okay. Again, the estrogen helps to prepare the inside lining of the uterus, and they will continue the progesterone also until the day of the embryo transfer, and they will continue with the vaginal progesterone after the embryo transfer, again until 8 weeks of pregnancy or until we advise them to discontinue the administration. So it's more just progesterone and estrogen that they will use.
Okay. Sorry, I think the connection is quite bad. It's bouncing tonight quite a bit. But you can see me on your side. Everything's fine on your side?
You're 100%.
Okay, perfect. What happens inside the IVF laboratory on the day of an embryo transfer?
Okay, so this is more our field and what we do and what we see. So again, there's a slight difference between when we prepare for a fresh embryo transfer versus a frozen embryo transfer. So for fresh embryo transfers, we would have a look at the patient's embryos inside our embryoscope. So that's a very specialized time-lapse incubator we have at Wijnland Fertility. And what this embryoscope does is it takes photos every 15 minutes of the developing embryos, and it sort of creates a video for us that we can play backwards and forwards. So we are able to assess these embryos every step of the way for the entire 5-day development. And I think that's a very powerful tool to have. So that we, on the day that the patients arrive for the embryo transfer, we already know which embryo had optimal division patterns and which embryo has an optimal embryo grading for us to choose that embryo to transfer first. So what basically happens is we would then remove this embryo from the incubator about half an hour before the patient's transfer, and then we would put it in a very specialized type of transfer medium that we call embryo glue. So it contains hyaluronan. And what this embryo glue or transfer medium does, it essentially helps the embryo to implant and basically stick into the uterus like the name suggests. So that would happen more or less half an hour before the transfer. And then by the time of the embryo transfer, we would just transfer directly from that medium into the uterus. Okay. So that's for fresh cycles. Then when we look at frozen cycles, let's say a patient has a transfer that's scheduled at 11 o'clock. Then the embryologist would come into the lab round about 3 hours prior to that transfer time so that we can thaw the embryo that we froze in a previous cycle for the patient. And this thawing process also happens via a very specialized technique that we use at Wijnland. So we would then thaw the embryo, we would place it in culture medium for that remaining 3 hours until the transfer time. We would assess the embryo again just before the transfer, around about half an hour again before the transfer, and it would be the same for the fresh transfers. We would then place it in that embryo glue media and transfer from that media into the uterus.
Well, it's actually, I'm hearing how much work actually goes into
Yeah,
you know, what you guys actually do there in the lab before it
definitely.
actually gets to the doctor to be transferred. It's quite a lot of work.
Definitely. We are truly
If I may
babysitters. We
ask,
are babysitters.
absolutely. There's there's a question I actually want to ask that I don't have on the list, if you don't mind me asking, but is does your procedure differ from, would procedures like this differ from clinics to clinics? Does everyone have their own way they do things?
Yeah. Yeah, definitely. I think listening to all these different conversations about how we did it at this clinic and how that clinic does it, it's valid and it's definitely true. Different clinics have different protocols that they've adopted that works for them and that contributes towards their daily operation and their success rates. So I
Yeah,
think patients and listeners should keep in mind that this is only experience from Wijnland's side, but there's a lot of clinics out there with very good success rates, and all of
yeah,
us have our method that works for us. And I don't think there's really a right or wrong way when it comes to
yes,
IVF. I think it's more of a, we have to accommodate the patient, and we sort of have to fit our treatment to suit the patient as well. So this may
absolutely.
definitely differ between clinics, especially when some clinics don't even have the time-lapse incubators that we have at Wijnland Fertility. So their method of operation would completely differ from how we do it. So yeah, I think it's a very good question to ask. It's something to definitely keep in mind that there are different methods out there and different protocols that
Yeah,
all work very well.
awesome. Um, okay, the next question is, how do I know that the embryologist selected the right embryo to transfer, and how many embryos can be transferred?
So this is the part where we can get quite geeky, I must say, because it's everything that has to do with the lab is like quite exciting for us. So when it comes to choosing the right embryo, again referring to the embryoscope, it's really a fantastic tool that we have, and I think we are very lucky as embryologists to have access to that technology. Because the embryoscope, as it allows us to play these embryo videos back and forwards, we are really able to assess that embryo every step of the way. And what we do is we call it morphokinetic parameters. So there are different things, basically different moves embryos make that we assess. And based on those morphokinetic parameters, we are able to decide what this embryo's implantation potential is. So we look at different things like we look at when fertilization occurred, when the first division occurred, how does the subsequent divisions look like, how did the embryo compact, how does the blast look in the end? What's the quality of the blast? So those are the different morphokinetic parameters we use together with an international grading system we call the Gardner grading system of embryos. And those two components help us to sort of rank embryos according to their implantation potential. So we would then assess the embryos available on day 5. We already know their morphokinetic parameters because the embryoscope helps us with that. We grade the embryos, and then we are able to assess them, which embryo is the one that we select to transfer first. And any other embryos that falls into that ranking subsequently will then be frozen in that order as well. So the patients will have sort of a list of embryos according to how we would prefer to transfer them based on that ranking system that we use. So when
Okay,
it's a fresh embryo transfer, again, we would look at the embryoscope and the data that we input in the embryoscope, and we would transfer based on that and the grading of the embryo on that day. For patients that have a frozen cycle, we already have that data. We froze the embryos in that order. So we have a straw number that correlates with the embryo ranking, and that is recorded on the patient's freeze reports as well as on our internal database. So we would know every time we thaw a straw for a patient to transfer that one is the one out of that current batch that we think has the highest potential of implantation. And we would just subsequently follow the list how we ranked it initially. So that's how we
okay.
know.
Awesome. I loved one of the comments that someone made. Isn't said, "Love how her face lights up talking about her work," and that's absolutely awesome. And then another one said, "The best clinic, the doctors and staff is truly amazing." So great to get comments like that. That's awesome. Okay, so the next question is, what can patients expect on the day of an embryo transfer?
So I think the previous question, I think I missed something about you asked how many embryos can be
Yes,
transferred, if
how
I'm not
many?
mistaken.
Awesome. Yes, yes. How many embryos can be transferred? Sorry about that.
So, no, it's completely fine. So at Wijnland Fertility, we adopted the guidelines provided by SASRAG in terms of single embryo transfers per cycle. So we generally, that's the normal rule. It's always one embryo per transfer. And we especially do that in cases where the females are younger than 37 years of age, or in cycles where we used donor ova. So that would always be single embryo transfer cycles. There are always exceptions to the rules, but that is the general rule at Wijnland. And then there are, like I said, exceptions. We do two embryo transfers as well, where we put two embryos back, but those are cases that are usually discussed between the patient and the clinician. And I think what's important there is the patient must also be aware of risks involved with twin pregnancies. So at
Yeah,
Wijnland, we really place emphasis on counseling. It's really important that our patients are well informed before making decisions like that. And we have a specific department that helps patients to make those decisions, so that they are well prepared for that. So very exceptional cases, we can do two embryos. Clinicians will look at stuff like the patient's age, how they respond, are they able to carry twins? There's a lot of factors involved in that. But in general, it's one embryo per transfer. And I think the goal for us always is a healthy singleton. I think when we've achieved that, we are quite
yeah,
happy. So we would like to keep it safe and do one embryo per transfer. And again, if I must talk about the embryoscope again, that's why that tool is so good to have, because that
yeah.
helps us to single out that embryo that we know it looks fantastic and it really has a good potential of implanting.
Okay, okay. What can patients expect on the day of an embryo transfer?
Okay, so again, for us in the lab, this is the most exciting day because it's sort of like when we see our hard work pay off. And it's when
Yeah,
we see the embryo goes to its home where it wants to be. So typically we would, ask our patients to take this is sort of like a checklist, so stuff that patients can remember to do on that day. So we ask them to take about 750 mils of liquid before your embryo transfer. So in the morning when you wake up and you prepare and make your way to the clinic, take your 750 mils of liquid, either coffee or a tea or some water, because we want your bladder to be full by the time of your transfer. So I know automatically the second question is, okay, why do I need to have a full bladder? So
yeah,
we use ultrasound guidance when we do our embryo transfers, and the bladder really helps us to visualize the uterus in an optimal way so that we know that where we want to place the embryo back, it's a clear, unobstructed view for us. So usually the bladder looks like a little U shape, or the uterus looks like a little U shape. And as the bladder fills up with water, it sort of presses down on the uterus and it creates a nice linear image for us to
yeah,
optimally, like I said, place the embryo. So that would be why we ask, please take the liquid before the transfer. So when patients arrive at the clinic, we would quickly look at their bladder to see if it's full. And if we are happy, we would prepare them for transfer. So the transfer procedure takes about 10 minutes. It's very, very quick. And there's a few things involved with the transfer. So firstly, we will have to insert a speculum in the vaginal canal, so to ensure that we have a nice unobstructed view of the cervix. Secondly, your clinician will have to insert the catheter guide. So that is sort of the little pathway that is predetermined and created and measured so that we know by the time we load the embryo into the uterus that the distance and the placing and the positioning is already calculated.
yeah,
And then the doctor would quickly see if the guide is in the perfect place. The embryologist will then go into the lab and just load the embryo into the catheter. We would then thread the catheter through the catheter guide, and this all happens under ultrasound. So we are able to see on the ultrasound machine what we are doing and what's happening inside the uterus. So by this time, we usually ask our patients to look at the sonar machine because they are also able to see, what's happening, what we are doing inside. So when we've placed the catheter in the position, patients will see a little white flash on the sonar machine, and that's usually the moment where we expel the embryos into the uterus. I know patients usually then ask, is that my embryos? But that's actually the media that surrounds the embryos and the little air pockets that we create when we load the embryos to help us visualize when the embryos are inside the uterus. So after that is done, we go back into the lab with the catheter and we just quickly rinse out the catheter to see if the uterus if the embryo is inside the uterus.
yeah,
And that's basically the transfer. It's very, very quick. It sounds very long, but it's 10 minutes.
yeah,
It goes by so quickly. And then afterwards, we would just ask our patients to take a 10 to 15 minute resting time after the transfer on the theatre bed. Um, just to sort of like, take in the moment, give the uterus a little bit of a break before they go back to their normal activities. Um, Again, I want to mention here that protocols differ at different clinics. So some clinics might ask you to lie down for 5 minutes, and some clinics might ask you to lie down for 10 minutes, and others don't even have a resting period after your transfer. Again, there's no right or wrong there. I think it's just clinic protocol, and clinics do whatever they think is best for their patients. But at Wijnland Fertility, that is how we do it. And then after a transfer, we really encourage patients to go back to their daily normal life. If you have to do grocery shopping, or if you have to cook, or if you want to take a light walk, patients are welcome to do so. No strenuous activity, just normal daily movement is really what's recommended after an embryo transfer.
Okay, that's great. Um, what is there any pain or discomfort to be expected during an embryo transfer?
Um, I always say that an embryo transfer should be painless, but with expected discomfort.
Yeah,
Reason being is you will have a full bladder, so that in itself is very uncomfortable.
yeah,
Secondly, we will apply pressure on your abdomen with the sonar probe so that we can see what's happening on the sonar machine, because that's basically our eyes at that stage. So that can be a little uncomfortable because your bladder is full. And then thirdly, you will have a speculum inserted as well. So the three of those can contribute to some discomfort, but
yeah,
overall, there shouldn't be any pain. And we usually just encourage patients to just breathe through the whole process and, just be engaged in the process, because it's quite an important moment, I think. But
yeah.
it should be pain-free, definitely.
Okay. Can I have twins with IVF? And can you see the sex of the embryo?
Sure, we get this question a lot. So if we speak about twins and IVF, so if after a single embryo transfer, having twins or the embryo splitting into two is very, very rare. It doesn't
Mm,
really occur that often, and it occurs about less than 2% of cases. For people to have twins through IVF, we would need to transfer two embryos of more or less similar development and quality. And again, this brings us back to our question earlier. It should be a discussion between the patient and the clinician, whether the patient is able to carry twins, age taken into account, and stuff like that, all those factors. But yeah, IVF, a single embryo splitting into two, is a very rare occurrence.
okay.
And the sex of the embryo, we get that so many times, but we are unfortunately not able to see the sex of the
Yeah,
embryo. Like we can't say an embryo designated to be a boy looks like this and a girl embryo looks like
yeah,
this. So for us in the lab, they're all embryos. And there isn't any way of telling, what the sex is. And the only way of telling the sex of an embryo is to do genetic testing. But that
yeah.
only happens in indicated cases. For instance, patients with sex-linked disorders in their family that want to rule out those disorders in their family, they would be allowed to do genetic testing. Let's say if it's a specific male condition, we would then have to test the embryos to rule out any male embryos. But
Okay.
otherwise, genetic testing just for family balancing is unfortunately not yet accepted in South Africa
Yeah.
at this stage. So it's only as per, indicated cases. But it would be very cool if we were able to see,
Yeah.
what the sex of the embryos were.
I was actually going to ask because that is a question I get a lot. Someone looking,
Yeah,
they've got all girls and they're
yeah,
looking, they want to have a boy. But I do know that it's illegal right now, and I think we should
yeah,
just put emphasis on that and let women know, or couples know that it is illegal in South
yeah.
Africa to do that.
Definitely. I
Okay.
think we're not yet there with that yet. I think it's an ongoing battle because family planning is quite, it's an important fact. And I can imagine for a couple trying
Yeah.
for a girl and they have four boys, and every time it's just a boy. So I can understand those cases, but yeah, we're not there yet. Hopefully in future we would get a little bit a step closer. But as of yet, unfortunately, your family balancing and genetic testing does not go hand in hand.
Yeah. Okay, so we've got a question that came up earlier. What are the risks involved with two embryo transfers?
I think it really comes down more to neonatal and obstetric outcome. Again, it should be the safety of the mom as well as the
Yeah.
safety of the infant. So that is how clinicians decide, would this be an optimal patient to do to transfer two embryos? It's more your obstetric and neonatal risk. That's actually where it comes down to. So we really want the patient to be healthy and we want the baby to be healthy. And that's why the goal actually is healthy singletons. That's what we focus
Yeah.
on because we know that that's a bit more. Every pregnancy has its risks, but that's what we aim for. And like I said, under very special circumstances, we do the two embryos with very careful counseling of patients. But it comes down to the obstetric outcomes.
Okay. Thank you so very much for this talk. I don't know if you can at least give some advice to women that is going to be doing these embryo transfers soon or going to be doing IVF. There's always a talk about keeping your feet warm. Are there any tips like that for the ladies out there?
Shame. I think for me, it's very important for patients to just know that, especially at Wijnland, you are supported, you are heard. We see your pain, we see the tears, we know you are uncomfortable, we know that it's an unknown situation for you. We know we've experienced all those emotions with you. So at Wijnland, we are very involved in our patients' cycles, and that can be a pro and a con sometimes. But I think, when we
Yeah,
cry, we all cry together. So I think for
yeah,
patients undergoing an embryo transfer, it's happening in a few days or it's coming up for you in the next month or two, breathe through the process. And I think the most important part is trust your lab and trust your embryologist and your
yeah.
clinician because this is what we do every day. This is what we live and breathe every day. So we do get those occasional calls, how's my embryos doing? And it's like the day before an embryo transfer. Trust the process. We are with you every step of the way. So I think you'll just breathe through the process, but also appreciate the process because your journey differs
Yeah,
from people out there. And you have a
yeah.
new addition and a new story to tell in how your journey differs from someone else in the IVF industry. So you'll just breathe the process and really you'll take it step by step with us because we walk the way with you and you'll just enjoy it, just enjoy it because that is essentially the journey that was designated for you
Yeah.
and we are there to support you all the way.
Okay, that's such amazing saying that you have. I've got another comment here. A great support. Let me just read that. A great support structure. Dr. Van Baart and Dr. Lizanne Van Vaart was truly a strength for us. Thank you so much for that. You're getting such a lot of good reviews and comments here this evening, which is
I'm so
always
glad.
very nice. Yeah, so thank you very much for taking time out to do this talk with us. And as someone mentioned earlier, I love the way you light up, your face lights up when you're talking about what you do. So you clearly love what you're doing.
I really do.
Um, Awesome. As somebody just mentioned, I will be coming very soon for my frozen embryo transfer. This was useful. Thank you very much. Thank you very much for joining us this evening. If you can please leave your details for us, and then if anyone wants to get in contact with you guys at Wijnland, they can contact you.
Definitely. So we have two general email addresses. So they are welcome to email us at info@wijnlandfertility.co.za or admin@wijnlandfertility.co.za. You're welcome to email me as well, elsa@wijnlandfertility.co.za. And we also do have a landline, so they're welcome to contact us on 021 882 9666.
Okay, great. Thank you very much for this evening, and I hope you have a great evening further.
You
Thanks,
too. Thank you
Elsa.
very much again
See you
for the
soon.
opportunity. We do love it. Thank you. Bye.
It's a pleasure. Bye.
Bye-bye.